Hey guys, welcome to AMC Doctor. I'm back after a long time. I stopped doing videos once I started working as I needed some time to adapt to my first job in Australia. Now that I've settled into my work, I'm back with some more videos. Today in this video, I'll be going through a case. This video might not be the best one for beginners who have just started preparing for their AMC clinical examination because I'll be focusing mainly on the approach to this recall rather than the format and how to present. So today we'll be going through this recall. Young patient returning from overseas, tried heroin, now presents with feeling unwell, and the task is to take history, PV, and differential diagnosis. Now, this is a fairly common recall, although with the given information and chief complaint feeling unwell, it can mean anything, by which I mean if you don't know the recall, you can easily get lost, given the time limitation during your exam. So just a quick tip here, especially for the beginners, that you need to study recalls or past questions for AMC clinical examination. And I believe this is true for any exams, isn't it? So same thing for AMC, unless it's a pilot question, almost all questions are repeated. So you should know the recalls and also the story or the positive finding for that recall. So the positive findings for this case includes this young patient who went overseas for holidays with his friends, used heroin, but just once. History of needle sharing, now feeling unwell. And on further elaboration, he would say that he's a bit tired. There's also a history of right upper quadrant abdo pain. He's non-smoker, history of alcohol, binge drinking, again, not regularly, but only like once off. And in PV, you'll find there is a positive finding for right upper quadrant tenderness and bilirubin in urinalysis. So once we know the story, let's go back to our question and see how we can approach this case. So what I do is, because this is all the information that you get before you start taking history, I look for keywords in the stem that can help you formulate a differential, which is one of the main tasks here. And depending on the differential diagnosis that I come up with, it will further help me think of all the important stuffs that I need to ask during the history and PV. For example, for me in this recall, feeling unwell is one of the keywords. Others maybe overseas and use of heroin. So feeling unwell is the chief complaint for me. And when it comes to overseas, I'll be thinking of different infectious diseases as my differential. Use of heroin, I'm thinking of blood-borne viruses such as hepatitis B, hepatitis C, HIV as my differential. So once you've got enough of differentials, then you can think of the history and PV accordingly. Now let's look at history. So you'll start with your chief complaint, that is feeling unwell. And just like Socrates' question for pain, you need to ask questions related to feeling unwell, like what do you mean by feeling unwell? Also ask since when. And also any other systemic symptoms. And because you're thinking of infectious diseases in your differential because of the travel history, which could be anything from malaria, parasitic infections, TB, and even COVID, given the current situation. So ask about fever and few questions related to all systems. And mainly these questions revolves around your differentials. For example, ask about fever, cough, chest pain, sore throat, which could mean chest infections, some gastro symptoms, and because there is hepatitis in our differential, you can ask about nausea, vomiting, loss of appetite. Similarly, in early HIV infection, lumps and bumps, sore throat, fever can be important. Then comes questions regarding heroin use. So here you want to ask about its quantity, the route. Mostly heroin is injected, rarely smoked. You also want to know is how often did he use. Also ask about needle sharing, and this is a young patient, so also ask about use of any other illicit drugs or non-prescribed medications. Ask about smoking, alcohol history. And finally, sum it up with past medical history, sexual history, medications, and allergies. Now, moving on to PFE, asked about the general appearance in OBS or vital signs. My main concern would be temperature. In pill cyclode, look for jaundice. If because we are thinking of acute hepatitis, think of rash, lymphadenopathy in early HIV infection. So these are important. And then the other thing is injection site. So ask for this, examine this site, looking for any cellulitis or localized abscess. Again, if it was a substance use disorder, you may get findings such as track marks, which are just scars that follow the course of veins due to repeated injections. But again, this is unlikely in our case, which is more like a once-off thing. Then in abdomen, tender hepatomegaly is very important. And CVS, some people also think infective endocarditis as differential. So if that's the case, then also ask about the heart sounds, murmur. And then go through the chest, urinalysis. And here's what you'll get, one of the positive findings, that is bilirubin in urine. And finally, we come to our differential diagnosis. And as we discussed initially, when we didn't know the positive findings or before taking the main history, our main differentials were blood-borne viruses and infective diseases. However, we have to tailor our differential according to the positive findings we get when we take the history. As for example, in this case, there was positive findings for right upper quadrant pain, right upper quadrant tenderness, jaundice. So your differentials should be based on this. So here's the list of differential diagnosis for me. And these are hepatitis, cholecystitis, pancreatitis, HIV, gastritis, peptic ulcer disease, infective endocarditis, and just explain all these accordingly to the patient. You can always add other differentials to this list, but just make sure that you ask relevant history and physical findings accordingly. Well, apart from these points, the other very important thing is to keep a non-judgmental approach and acknowledging him for sharing all the information. At any given time, if you feel he's worried about the blood-borne viruses, don't forget to acknowledge and reassure him. So that's it for this video. Thank you so much for watching. Hope it was helpful. If you guys have any suggestions on what videos I should do next, please leave a comment down below. I'll try my best to get to it. Thank you.